we have managed to accrue blood samples from a fairly large number of patients with pancreatic cancer who have diabetes, who don't have diabetes, and patients who just have diabetes with no pancreatic cancer, because that's a very important control group. And of course, we've tried to match these patients as much as possible for age and gender. And then the laboratory of my collaborator, Dr. Devraj at Baylor, has been using these blood samples to look at a very large number of abnormal proteins in the blood using pretty sophisticated instruments to identify those that may be abnormal in patients who have pancreatic cancer and diabetes, but not pancreatic cancer without diabetes and not in diabetes alone. So that's really sort of our money game here, to go after those proteins in the blood that we can detect with a simple blood test that will only be positive in that one subset of patients. Because if we find those abnormal proteins in the subset that has both pancreatic cancer and diabetes, we can eventually get to the point where we can start screening all new onset diabetics for that little subset of patients who also have a concurrent